Hey everyone, welcome back. Today I'm going to discuss what an A1c is. I'm also going to share the new 2021 American Diabetes Association A1c recommendations. And then lastly, I'm going to give you a few opinions of what I think about A1c. So hopefully you enjoy. Stay tuned. Thanks for sticking around. If you're new to the channel, my name's Nick and I'm That Diabetes Guy. So let's go ahead and jump right into it and let's discuss what an A1c is. So A1c, the more formal name of saying it is hemoglobin A1c. And this is a laboratory test that your provider may order if maybe you have some history of prediabetes, or you have some of the risk factors for diabetes, or maybe they're just managing your diabetes. But an A1c lab result really gives us an estimated average blood sugar over the past 2 to 3 months. A1Cs are really helpful for the providers. They can use A1C results to help diagnose diabetes. They could use the results to help adjust therapies or recommend certain lifestyle interventions, or even develop a risk assessment profile for any diabetes-related complications. Well, how does the A1C result tell us our average blood sugar over the past 2 to 3 months? As glucose enters into our bloodstream, the sugar molecules attach to the hemoglobin, which is our protein molecule in our red blood cells. So imagine this is our red blood cell, and here's our little glucose molecule. And as it's being saturated into the bloodstream, they kind of catch on and they stick. So over time, you'll see as new red blood cells are created, the sugars will just constantly keep on sticking to it. But the life cycle of a red blood cell is only 2 to 3 months. So that's why your provider might not order it every month or every 2 months. Oh, we just lost a palm. It's less likely that your provider would order an A1C earlier than 3 months. And the reason being is we know we have to wait 2 to 3 months for all your red blood cells to turn over. And by waiting for new red blood cells to develop, it's kind of like pulling in a new average blood sugar. And so we don't want to draw from old averages. We want to get a nice fresh average. So we're going to wait 3 months each time to really be able to compare previous A1Cs. For the individuals that have A1C results, but they don't know the average blood sugar conversion, I'm going to post a chart here so you can review. And if you'd like, I'll post in the description below. You can click on a link and enter it into a calculator and it will convert it for you. So imagine if an individual is on a medication that can cause low blood sugars, or they're insulin requiring, whether they have type 1 or type 2, it really isn't going to capture the variability in glucose from a day-to-day perspective. So you can have a lot of highs and a lot of lows, but again, it might come out to a really good average. And I kind of try to show this in a skit, so hope you enjoy. I want to create an experiment to kind of explain what an A1C kind of represents when we're talking about averaging of blood sugars. So before I get started, please do not try this at home. So for lows, let's create a low dish here. All right, whoops, all these cubes. So the ice cubes are going to represent low blood sugars that I've been having. Get some water in there. We're going to get this nice and cold. I want to add some salt to melt that ice. Oh yeah, that's probably too much. Oh, we're cooking. All right, so the ice cold water is the pot representing low blood sugars, and this pot of, well, not boiling yet, hot water is representing my high blood sugars. And imagine, we don't want either one of these here. So, it gets very, that's cold. It gets very uncomfortable having a lot of lows and also a lot of, oh God, that pan's hot. A lot of highs. And we don't want this when we're managing our blood sugars. But an A1C can't tell the difference. Oh my God. Between highs and lows. Oh gosh. So here's our A1C calculator. Oh, So let's calculate our A1C. We got our lows. Shaky. And our highs. Yeah. And like I speculated, when we checked it, it looks fine. Room temperature. Everything's great. Oh. Heather, can you take me to the hospital? I think I burned myself. Well, I hope everyone enjoyed that lesson regarding A1C blood sugar averages. Well, at least I did. So now let's talk about the new 2021 ADA A1c recommendations for various age groups. For children and adolescents with type 1 diabetes, A1c goals should be individualized and reassessed over time. An expected A1c of 7% or less is appropriate for many children. Less stringent A1c goals of 7.5% or less would be appropriate for those who cannot articulate symptoms of hypoglycemia, have hypoglycemia unawareness, maybe they lack access to analog insulins or advanced insulin delivery technology or CGMs, or they just can't check blood sugars on a regular basis. Providers may reasonably suggest a more stringent A1c goal of 6.5% or less for those who can achieve this without any significant hypoglycemia or negative impacts on well-being. Children and adolescents with type 2 diabetes should have their glycemic status assessed every 3 months. The reasonable A1c target for most children and adolescents with type 2 diabetes that are treated with oral agents alone is 7% or less. More stringent targets of 6.5% or less may be appropriate for those who can achieve this without any significant hypoglycemia or any other adverse effects of treatment. However, less stringent A1c goals of 7.5% or less may be appropriate if there's an increased risk of hypoglycemia. For non-pregnant adults, a reasonable A1c goal should be 7% or less. Providers might suggest a more stringent A1c goals, such as 6.5% or less, for select individuals that can achieve this without any significant risk of hypoglycemia or other adverse effects of treatment. Appropriate individuals might include those with short duration of diabetes, type 2 diabetes treated with lifestyle interventions or metformin only, long life expectancy, or no significant cardiovascular disease. Less stringent A1c goals would be 8% or less, and this would be appropriate for individuals with a long-standing history of severe hypoglycemia, or have a limited life expectancy, advanced micro or macrovascular complications, or having a long-standing diabetes history in which it's very difficult to achieve their goals despite having diabetes self-management education and training. For older adults who are otherwise healthy and have few coexisting chronic illnesses and intact cognitive function and functional status should have lower glycemic goals such as 7.5% or less, while those with multiple coexisting chronic illnesses, cognitive impairment, or a functional dependence should have less stringent glycemic goals of maybe 8 to 8.5% or less. All right, everyone, we're winding down here, and I'm just going to share a few opinions regarding A1Cs. So first off, A1Cs are just a number that gives us a broad picture of glycemic averages over the past 2 to 3 months. I've said that multiple times already, but it doesn't define you as a person. So for those individuals managing diabetes, do not get hung up on the idea of I'm good or bad. It really isn't that. It's more saying this is where you are, and if you need to maintain, great. Or if you need to make changes, well then let's work together and work on that. And then lastly, there's so many things that affect glycemic control, and I'm sure this will be another episode or a series of episodes that I want to talk about. But we're kind of in a hard spot right now during a pandemic, and our life has kind of been changed maybe forever, and that there's a lot of uncertainty, whether it's job security, food security, insurance. A lot of people lost their job, people lost a loved one, and all these are stressors. It could be stressors of dealing with pain or an illness, but these all affect blood sugars, and these are things outside your control that would affect A1C averages. So give yourself permission to say, you know what, maybe it's not at the most ideal place right now, but hopefully moving forward, we can work on a little things to kind of get it in the right direction or maybe maintain control. All right, everyone, that's all I have for you today. I apologize ending on a somber note, but that's the reality, is that it's not always highs. We can have some lows too. And if you like the video, please consider subscribing, maybe liking, sharing the video, and please tell me what you think. So add your comments and tell me what you liked or what you didn't like, or maybe make some suggestions for my next few videos. So I appreciate it, and take care.